Good morning, everyone. I'm Dr. Reshma Patil. In today's class, we'll talk about necrosis and apoptosis. In previous class, we have spoken about morphology and structure of cell, reversible injury, its mechanism of ischemic, hypoxic injury, physical injury, chemical, ionizing radiation, then reactive oxygen ischemic reperfusion injury, and morphology of reversible cell injury. In today's class, we'll talk about necrosis and apoptosis. This is a simple flowchart which is explaining the consequence of the cell injury. When a normal cell with a normal hemostasis, when injurious stimuli is applied for shorter duration in lesser intensity, once the stimulus is withdrawn or upon restoration of blood supply or oxygen supply, it leads to reversible injury. Next, when the stimulus is of greater intensity and for longer duration, it leads to irreversible cell injury. And the consequence of irreversible cell injury is necrosis and apoptosis. Necrosis. The morphological appearance of necrosis is the result of denaturation of intracellular protein and enzymatic digestion of lethally injured cell. The necrotic cells are unable to maintain membrane integrity and their content often leak out. That process may elicit inflammation in the surrounding tissue. The enzyme that digests the necrotic cells are derived from lysosomes of dying cells or from the lysosomes of leukocytes, which are a part of inflammation due to necrosis. In simpler term, necrosis is nothing but denaturation or breakdown of intracellular protein and enzymatic digestion. These necrotic cells, what it will do is it is unable to maintain the membrane integrity. When it is unable to maintain a membrane integrity, content of the cell will leak out. Due to leakage of this content, the surrounding tissue will react to it. Once the content is leaked out, surrounding tissue will show inflammation, which is one of the important characteristic feature of necrosis. Here is a photograph. You can see electron microscopic photograph. This is a normal tubular epithelium of the kidney, which is showing microvilli and lumen and normal mitochondrial bodies. And in second, you are seeing electron photograph of reversible cell injury of proximal tubule. You will see there is few loss of microvilli and electron dense deposits. In third, it is a irreversible cell injury. There is complete loss of microvilli, formation of cytoplasmic blebbing and amorphous deposits within the mitochondria. Coming to histopathological pictures, here you can see a photograph. It is showing normal tubule with a normal cytoplasmic nuclear ratio and normal in color. Second photo, you are seeing cell which has undergone necrosis. You can see cytoplasmic blebbing and abundant eosinophilia of cytoplasm, nuclear shrinkage. In third photograph, tissue has undergone necrosis. You can see cytoplasmic vacuolation and loss of nucleoli. Coming to morphology of necrosis. Necrotic cells show increased eosinophilia in hematoxylin and eosin stains. Necrotic cells may have more glassy, homogeneous appearance than the normal cells. When enzymes have digested cytoplasmic organelle, the cytoplasm become vacuolated and appear moth-eaten appearance. Dead cells may be replaced by large whorled phospholipid mass called myelin figures that are derived from damaged membrane. These phospholipid precipitates are then either phagocyted by other cells or further degraded into fatty acids, and these liberated degraded fatty acid combines with calcium and cause deposits, and this whole process is known as saponification. Dead cells may ultimately become calcified. Now you should know about electron microscopic features of necrosis. Necrotic cells show discontinuity in plasma and organelle membrane. There is marked dilatation of mitochondria with appearance of large amorphous densities. Intracytoplasmic myelin figures, amorphous debris, aggregates of fluffy material representing denatured protein. Coming to nuclear changes of necrosis. There are three important nuclear changes. First one is karyolysis. In karyolysis, what happens is the basophilia of chromatin which will fade due to loss of DNA, because loss of DNA is because of enzymatic degradation by endonuclease. Second is pycnosis. It is characterized by nuclear shrinkage and increased basophilia. Here chromatin will condense into solid shrunken basophilic mass. And the third pattern is karyorrhexis. The pycnotic nucleus undergo fragmentation. With the passage of time, day or a two, nucleus of necrotic cell will totally disappear. These are the following changes in necrosis: karyolysis, pycnosis, karyorrhexis. These changes will be seen in nucleus of the necrotic cells. Coming to different patterns or a type of tissue necrosis, there are 5 major types of necrosis. First one is coagulative necrosis. Second one is liquefactive necrosis. Third, caseous necrosis. Fourth, fat necrosis. Fifth, fibrinoid necrosis. Sixth, gangrenous necrosis. Now we'll talk about one by one. First, you should know about coagulative necrosis. Coagulative, it is a form of necrosis in which architecture of dead tissue is preserved for a span of at least some days. The affected tissue exhibit firm texture. Injury denatures not only structural protein but also enzymes, and so block the proteolysis of dead cells. Eosinophilic nucleate cells may persist or for a day or a week. The necrotic cells are removed by phagocytosis of cell debris, by infiltrating leukocytes, and by digestion of dead cells by action of lysosomal enzymes of the leukocytes. Ischemia caused by obstruction in vessels may lead to coagulative necrosis of the supplied tissue in all organs except for brain. Localized area of coagulative necrosis is called as infarct. Here is a photograph of kidney. You can see coagulative necrosis. This is a gross image of kidney. You can see localized coagulative necrosis, which is also known as infarct. It is due to occlusion of blood supply for the longer duration. And this is a photomicrograph. Here you can see renal tissue with glomeruli. On the left side you can see normal glomeruli, kidney tissue, and then on the right side which has undergone the necrotic areas. This is a photograph of the kidney which has undergone necrosis. Here you can see glomerulus, rounded structure, and these are the tubules of the kidney. Here you can see complete loss of tubule has undergone necrosis. Cell architecture is maintained but loss of features, like there is increased eosinophilia of the cytoplasm and loss of nucleus, and surrounding tissue is showing inflammation. This is about necrosis, coagulative necrosis. Now you should know about next variant, liquefactive necrosis. This is characteristic by digestion of dead cell resulting in transformation of tissue into liquid viscous mass. It is seen in focal bacterial or fungal infection because microbe stimulates the accumulation of leukocytes and liberation of enzymes from these cells. Necrotic material is frequently creamy yellow because of presence of dead leukocyte. For an unknown reason, hypoxic death of cell within the central nervous system often manifest as a liquefactive necrosis. This is the gross image of a liquefactive necrosis. Here you can see a brain tissue and there is a focal area of liquefactive necrosis which forms a liquid viscous material. It may be due to focal, fungal or bacterial infections. Next, you should know about gangrenous necrosis. It is not a specific pattern of cell death, but the term is commonly used in clinical practice. It is usually applied to a limb, generally lower limb, that has lost its blood supply and has undergone necrosis. Typically cognitive necrosis involving multiple tissue plane, and this is called dry gangrene. When a bacterial infection is superimposed, there is more liquefactive necrosis because of actions of degradative enzyme in the bacteria and attracted leukocyte. Then it is called wet gangrene. Coming to next type, caseous necrosis. Caseous necrosis is most commonly seen in tubercular patients. The incidence of tuberculosis is more in India. Caseous necrosis is encountered in a foci of tubercular infection. The term caseous means cheesy-like. It is derived. It is a friable white appearance area of the necrosis. On microscopy, necrotic area appears as a collection of fragmented oralized cells and amorphous granular debris enclosed within a distinctive inflammatory border. This appearance is a characteristic focus of inflammation which is known as granuloma. Granulomas are most commonly seen in tubercular infection. In granuloma's central portion, you will see caseous necrosis, surrounding which you will see modified macrophages which are called epithelioid cells, lymphocytes and Langhans type of Jane cells. This is a gross photograph of lung, apical area of lung which is affected with tuberculosis. Here you can see cheesy appearance on gross of the affected area. This is a photograph of granuloma. Here you will see central amorphous granular eosinophilic pink appearance which is known as caseous necrosis. Surrounding the caseous necrosis, you will see inflammatory infiltrate composed of lymphocyte, Langhans type of Jane cells and epithelioid cells, and this whole constitutes a granuloma. This is about the caseous necrosis. Coming to fat necrosis. It refers to focal area of fat destruction. Fat necrosis, this occurs most commonly seen in acute pancreatitis patient, resulting from release of activated pancreatic lipase into the substance of pancreas and the peritoneal cavity. In this disorder, pancreatic enzymes leak out of acinar cells and liquefy the membranes of fat cells in the peritoneum. The release of released lipase splits the triglyceride esters contained within the fat, and the fatty acid so derived combines with the calcium, gives a chalky white appearance on the grass, and this whole process is known as saponification. On histological examination, necrosis takes a form of foci of shadowy outline of necrotic fat cells with basophilic calcium deposits surrounding an inflammatory reaction. In simpler term, fat necrosis is most commonly seen in patients with acute pancreatitis. What happens in acute pancreatitis is there will be destruction of acinar cells because pancreatic enzymes are because of destruction of acinar cells, there will be release of pancreatic enzymes and which will liquefy the pancreatic membrane and the omentum. And these liberated enzymes like lipase, which will split triglycerides of fat into fatty acids, and these liberated fatty acids will combine with calcium, and this process is known as saponification. On gross appearance, it will appear as a chalky white deposits. This is a photograph of fat necrosis. This is a omentum. You can see chalky white deposits on the omental tissue. This is a photomicrograph. Here you can see adipocytes with basophilic appearance due to calcium deposition, and there is loss of cellular architecture. This is about fat necrosis. Next, fibrinoid necrosis is a special form of necrosis usually seen in immune reaction involving blood vessels. It is most commonly seen in vasculitis or vasculitic syndromes. This pattern of necrosis typically occurs when antigen and antibodies are deposited on walls of artery. Deposits of these immune complex together with fibrin that has leaked out of vessel results in bright pink amorphous appearance in HND stains, and these are called fibrinoid. It is seen most commonly in immunological mediated vasculitis syndrome. In simpler term, this fibrinoid necrosis is seen in vasculitis condition. Vasculitis, it is an autoimmune immune mediated disease in which antigen antibodies deposits on a blood vessel. When it combined with the fibrin from the vessels, it leads to fibrinoid necrosis. This is a photomicrograph of vessel. You can see vessel wall has undergone fibrinoid necrosis, and this fibrinoid necrosis is nothing but antigen antibody deposits with fibrin which has liberated from the vessel wall, which gives a bright pink appearance. This is about the necrosis. Necrosis is very important. It can be asked for 5 marks and rarely for 10 marks, and individual type of necrosis can be asked for 5 marks and sometimes short essay. This is all about the necrosis and its different types. Coming to next, apoptosis. Apoptosis is a programmed cell death. It is also known as falling off. Definition: apoptosis is a pathway of cell death that is induced by tightly regulated suicide program in which cell is destined to die activate an enzyme that degrades the cell own nuclear DNA and nuclear and cytoplasmic protein. I repeat, apoptosis is a pathway of cell death that is induced by tightly regulated suicide program in which cell is destined to die activates an enzyme that degrades the cell own nuclear DNA and nuclear and cytoplasmic protein. Apoptotic cell break up into fragment called apoptotic body, which contains a portion of cytoplasm and nucleus. Plasma membrane of apoptotic cells and body remain intact, but its structure is altered in such way that these become target for phagocytosis. The dead cell and its fragments are rapidly devoured before the contents have leaked out. Therefore, cell death by this pathway does not elicit any inflammatory reaction in the host. Apoptosis can be seen in physiological and pathological condition. Here are the few examples in a physiological situation where apoptosis takes place. The programmed destruction of cell during embryogenesis, which include during implantation, organogenesis, developmental involution, and metamorphosis. Involution of hormone dependent tissue upon hormone withdrawal, as in a case with endometrial cell breakdown during menstrual cycle, ovarian follicular atresia, in menopause, regression of lactating breast after weaning, prostatic atrophy after castration. Third, cell loss in proliferating cell population, immature lymphocytes in a bone marrow and a thymus that fails to express useful antigen receptors, B lymphocyte in a germinal center, epithelial cells in an intestinal crypt so as to maintain a constant number or a hemostasis, elimination of potentially harmful self-reactive lymphocyte either before or after they have completed their maturation so as to prevent reaction against own tissue, death of host cells that have served their useful purpose, like example neutrophils in acute inflammatory response and lymphocyte at the end of immune response. These are the following examples of physiological condition. This can be asked for 3 marks. Example in embryogenesis after including implantation, organogenesis, developmental involution, metamorphosis, endometrial breakdown in menstrual cycle, ovarian follicular atresia in a woman with postmenopausal woman, a regression of lactating breast after weaning, prostatic atrophy after castration, cell loss in a proliferating cell population like immature lymphocytes in a bone marrow and a thymus, B lymphocyte in a germinal center, epithelial cells in an intestinal crypt, elimination of potentially harmful self-reactive lymphocytes either before or after they have completed their maturation, and death of host cell after they have served their useful purpose, like in neutrophils in acute inflammatory response and lymphocyte at the end of immune response. Now you should know about apoptosis in pathological conditions. Apoptosis in pathological conditions like DNA damage. Once the DNA is damaged and the cell becomes mutated, the DNA damage can be due to radiation induced, cytotoxic induced, cytotoxic anti-cancer drug, hypoxia can damage DNA either directly or by production of free radicals, accumulation of misfolded proteins. Improperly folded protein may arise because of mutation in a gene encoding these protein or because of extrinsic factors such as damage caused by free radical, which accumulates in a apoptotic cell death. Cell death in certain infection, in viral infection, which loss of infected cell is largely due to apoptosis that may be induced by viruses or by host immune response. Pathological atrophy in parenchymal organ after duct obstruction. Such occurs in pancreas, parotid gland and kidney. These are the various examples in pathological conditions like DNA damage. DNA damage may be due to various conditions like radiation, cytotoxic anti-cancer drug, hypoxic induced DNA damage, accumulation of misfolded protein, cell death after viral infection, pathological atrophy in a parenchyma after duct obstruction, which may be seen in pancreas, parotid, kidney. Now you should know morphological features of apoptosis. Coming to morphological features, you'll see a cell shrinkage, and once the cell shrinkage, chromatin condensation, formation of cytoplasmic bleb and apoptotic body, phagocytosis of apoptotic cell or a body, usually by macrophages. Plasma membrane are thought to remain intact during apoptosis until last stage. In simpler term, there will be intact plasma membrane, there will be cell shrinkage and cell will appear dense eosinophilic with condensation of chromatin, and there will be formation of cytoplasmic bleb. This is a photograph. You can see On first photograph, this is epidermis is showing a cell which has undergone apoptosis. Here you can see cell size has been shrinked and there is increased eosinophilia and apoptotic bodies. And second picture is of electron microscopy picture. Cell are cultured and during apoptosis some cells are showing crescentic deposit at the periphery due to compact chromatin. In third, you can see apoptosis showing a bleb formation and apoptotic body. And this is the immunofluorescent photos. Now you should know about biochemical features of apoptosis. Caspase is an important biochemical mediator which leads to apoptosis. First, first mechanism is activation of caspase. Caspase family is divided into two groups: initiator caspase and executioner caspase. Caspase exists as an inactive proenzyme or a zymogen which must undergo enzymatic cleavage to become active. Presence of cleaved active caspase is marker of cell undergoing apoptosis. In simpler term, there are two groups of caspase. One is initiator executioner caspase. These caspase are present in proactive form and for it needs to be converted for its active form. This active caspase itself is a marker of apoptosis. DNA and protein breakdown. Apoptotic cell exhibit characteristic breakdown of DNA into large 50 to 300 kilobase pieces. Membrane alteration and recognition by phagocytosis. Plasma membrane of apoptotic cells change in a way that promote the recognition of dead cells by phagocytosis. Mechanism of apoptosis. Initiation phase. Caspase become catalytically active. Next, execution phase. Other caspase triggers the degradation of critical cellular component. Initiation of apoptosis occurs principally by signals from two distinct pathways: intrinsic, which is also known as mitochondrial pathway; extrinsic, or a death receptor initiated pathway. These pathways are induced by distinct stimuli and involve a different sets of protein. Both pathways converge to activate caspase, which are actual mediators of cell death. In simpler term, in initiation phase, there are two intrinsic pathway which takes place in mitochondria. It is also known as intrinsic or mitochondrial pathway, and the extrinsic, which is also known as death receptor initiated pathway. In these both mechanism, it will activate few caspase. Now we'll see about intrinsic pathway of apoptosis, which is also known as mitochondrial pathway. This pathway of apoptosis is the result of increased mitochondrial permeability. Once the mitochondrial permeability is increased, the release of pro-apoptotic molecules or a death inducer will be released into the cytoplasm. The mitochondria are remarkable organ in that they contain protein such as cytochrome C that are essential for life. When released into cytoplasm, it initiates the suicidal program of apoptosis. The release of these mitochondrial protein is controlled by a balance between pro-apoptotic and anti-apoptotic membranes of BCL family proteins. When the cells are deprived of cell survival signals or either DNA damage or misfolded protein induced in endoplasmic reticulum, any stress to the cell, sensors of damage or stress are activated. The sensors are also the members of BCL family. These proteins are BIM, BID, and BAD. These are sensors of apoptosis. These are the molecule which senses when a cell is under stress. These molecules contain single BCl2 homolog key domain that are called BH3 only protein. The sensors in turn activate two critical pro-apoptotic effector molecules. What the sensor molecule will do is, once the cell is under stress, it will activate a pro-apoptotic effector molecule like BAX and BAC, which form a oligomer that insert into mitochondrial membrane and create a channel that allow a protein from inner mitochondrial membrane to leak out into the cytoplasm. The net result of BAX and BAC activation is coupled with loss of protective function of anti-apoptotic BCL family member is released into cytoplasm of several mitochondrial protein that can activate the caspase cascade. One of these protein is cytochrome C. Once released into cytosol, cytochrome C binds to a protein called apoptosis activating factor, which form a wheel-like hexamer that has been called apoptosome. This complex is able to bind a caspase 9, which is a critical initiator caspase of the mitochondrial pathway, and the enzymatic cleavage of adjacent caspase molecule, thus setting up an auto-amplification process. This is a photograph. Here you can see initiation of apoptosis. One is intrinsic and extrinsic pathway. Intrinsic pathway is also known as mitochondrial pathway. Once the cell is under stress or injury, like withdrawal of growth factor, DNA damage, which might be due to radiation, toxins, or free radical injury, misfolded protein, or any kind of the stress, this will be sensed by the BCL2 family. And this B12 family effectors will, these sensors are BIM, BID and BAD. Once the cell is under stress, these sensor molecule will recognize and activates the BCL2 family effector molecules. BAX and BAC, these form a oligomeric channel, and there will be liberation of cytoplasm from mitochondrial membrane into the cytoplasm. And these, once the cytochrome is liberated, it will activate the apoptotic activating factor. These cytochrome will bind to apoptosis activating factor, and this molecule is called apoptosome, and this apoptosome will activate initiator caspase. And this is the extrinsic pathway, which is also known as death receptor pathway. We'll talk about it in further slides. This is about intrinsic mitochondrial pathway. Now you should know about extrinsic death receptor initiated pathway of apoptosis. This pathway is initiated by engagement of plasma membrane death receptor on a variety of cells. These death receptors are membrane of tumor necrosis factor receptor family that contain a cytoplasmic domain involved in protein-protein interaction that is called death domain, because it is essential for delivering apoptotic signal. The best death receptor are tumor necrosis factor receptor 1, and the related protein is called FAS, CD95. The ligand for FAS is FASL, and FASL is expressed on T cell that recognize a self-antigen and some cytotoxic T lymphocyte. When a FASL binds to FAS, 3 or more molecules of FAS are brought together, and their cytoplasmic death domain form a binding site for an adapter protein that is called death domain. It is FAS associated death domain. Fas-associated death domain is attached to death receptor, in turn binds to inactive form of caspase 8, again via death domain. Multiple pro-caspase molecules are thus brought into proximity. They cleave one another to generate an active caspase. The enzyme then triggers a cascade of caspase activation by cleaving and thereby activating other pro-caspase and active enzyme mediated execution phase of apoptosis. This is photograph showing extrinsic pathway or death receptor initiated pathway. Here you can see death domain, which has got a Fas molecule. This Fas death domain is in the cytoplasmic, and the ligand for Fas is Facil. It is a tumor necrosis factor group receptor, and these Fas associated death domain, 2 or 3 molecule will come together, get attached to pro-caspase, and once these 2 or 3 molecules will come together, there will be auto degradation, and due to auto degradation active caspase 8 will be liberated, and which is also known as executioner caspase, and apoptosis takes place. This is a photograph which is showing viable cell and the apoptosis cell. In viable cells, when the cell survival signals are present, and there will be production of anti-apoptotic factors of BCL family. Like anti-apoptotic factors are BCL2 or BCLXL. What it will do is the sensors and pro-apoptotic, it will bind the pro-apoptotic factors. Pro-apoptotic factors are BAX and BAD. Once it will mask these BCLXL, once it will mask BAX and BAC, there will be no leakage of cytochrome C, and when there is no leakage of cytochrome C, there will be no apoptosis. And this is the photograph which is showing apoptosis. Once there is lack of cell survival signal like irradiation or withdrawal of any growth or any stress to the cell, there will be DNA damage or misfolded protein. It will be sensed by the BCL family group like BIM-BID BAD, and this will release a effector molecule BAX and BAC, and these BAX and BAC form a oligomer and liberate a cytochrome which is present within the mitochondria into the cytoplasm. Once there is leakage of cytochrome C and other protein in the cytoplasm, which will lead activation of caspase. Once there is activation of caspase, apoptosis takes place. Next, you should know about execution phase. This is previously what we have spoken is about initiator phase. Now you should know about execution phase of apoptosis. 2 initiating pathway converge to a cascade of caspase activation which mediates the final phase of apoptosis. The mitochondrial pathway leads to activation of initiator caspase 9 and a death receptor pathway initiator caspase 8 and 10. After initiator caspase is cleaved to generate its active form, enzymatic death program is set in motion by rapid and sequential activation of executioner caspase. Executioner caspase such as 3 and 6 acts on cellular component. Coming to removal of dead cells. The formation of apoptotic bodies break up cell into bite-sized fragments that are edible for phagocytosis. Apoptotic cells and their fragment also undergo several changes in their membrane that actively promote their phagocytosis, so they are cleared before they undergo secondary necrosis and release their cellular content. Cells that are dying by apoptosis secrete soluble factors that recruit phagocytosis. Some apoptotic bodies express thrombospodin, an adhesive glycoprotein that is recognized by phagocyte and macrophage themselves. may produce a protein that bind to apoptotic cell and thus targets the dead cell for engulfment. You should know apoptosis in health and disease. Apoptosis takes place due to growth factor deprivation, DNA damage, protein misfolding. Apoptosis induced by tumor necrosis factor receptor family, cytotoxic T lymphocyte mediated apoptosis. And here are the few examples or a disorder associated with dysregulated apoptosis, which can be seen in cancer, autoimmune disorders, or disorders associated with increased apoptosis and excessive cell death, like in neurodegenerative disease, ischemic injury, death of virus infected cells. This is about apoptosis. Now you should know about difference between apoptosis and necrosis. Necrosis cell is enlarged, whereas in apoptosis there is cell shrinkage or reduction in cell size. Nucleus will show pycnosis, karyorrhexis, karyolysis. There will be fragmentation into nucleosome size fragment in apoptosis. Plasma membrane is damaged, whereas in necrosis, whereas in apoptosis it will be intact. Once the plasma membrane is damaged in necrosis, enzymatic content will be leaked out and adjacent tissue shows a inflammation in necrosis. Whereas in apoptosis, plasma membrane is intact and there will be no liberation of enzymes in the surrounding tissue. Therefore, there will be no inflammation. Necrosis is always a pathological, whereas apoptosis, it can be pathological or physiological. These are the various differences of apoptosis and necrosis. This can be asked for 5 marks. Next, you should know little in brief about necroptosis and pyroptosis. Necroptosis resembles a necrosis morphologically and apoptosis mechanically as form of programmed cell death. Necroptosis is triggered by ligation of tumor necrosis, factor receptor 1 and viral proteins of RNA and DNA virus. Necroptosis is a caspase independent but dependent on signaling by RIP1, RIP3 complex. RIP1, RIP3 signals reduced mitochondrial ATP generation, causes production of ROS, reactive oxygen species, and permeabilize the lysosomal membrane, thereby causing cellular swelling and membrane damage, as which occurs in necrosis. Release of cellular content evokes an inflammatory reaction as seen in necrosis. Pyroptosis occurs in a cell infected by microbes. It involves activation of caspase 1, which cleaves a precursor form of interleukin 1 to generate biologically active interleukin 1. Caspase along with closely related caspase 11 also cause death of infected cells. Now, in brief, to summarize about the apoptosis. Initiation of apoptosis. Apoptosis is initiated by withdrawal of normal cell signal or any agents of cell injury. Then initiation of death signal pathway. It may be due to intrinsic pathway or extrinsic pathway. Intrinsic pathway is also known as mitochondrial pathway. In this pathway, anti-apoptotic factors involved are BCL2, BCL-XL, whereas pro-apoptotic factor like effectors are PAX and BAC, and the sensors are BIM, BIT, BAD. Extrinsic pathway, tumor necrosis factor receptors are involved, FAS, and FASL is the ligament for FAS. Ligand, not the ligament. Activation of initiator caspase. In mitochondrial pathway, cytochrome C attaches to apoptosis activating factor and form apoptosomes, and a precursor procaspase is activated, and death receptors are initiated pathway. FASL binds to FASL ligament, FAS associated death domain, and it will activate caspase 8 and 9. Activation of apoptosis executing caspase. Executioner caspase 3 and 6 DNAs There you'll see chromatin clumping, cytoskeletal damage, disruption of endoplasmic reticulum, mitochondria, and cell membrane. Next step will be removal of dead cells. This is about apoptosis. Thank you.